Good afternoon. I'm so happy to have you here today. I am looking forward to our time together. My name is Carmen Wimberly Coffin, and this is Advocacy in Action, Navigating the Healthcare System. Today we're going to be talking about critical care and intensive care units. If you have questions, please post them in the comments and I'll try to answer them. If not, we will answer them on a separate live or separate post. Thank you so much for joining our group, taking care of us, and for joining me today. So how did I get here? I have taken care of family, sick family, and caregiving for the last, I guess, 20 some years. After I lost a child, we lost a child to violence, and I was diagnosed with a rare disease, pulmonary hypertension, and I was on oxygen 24/7. I was taking care of a sick child and a husband. I made the decision to come home for 6 months, and I never returned to work. I was then able to take care of my parents, my mother and my father, and until they both passed away. And I was able to then travel the world. I was able to be confident in speaking out about race and equity and fairness. I developed a business with the skills that I've learned, and I talk about community daily. And now I hang out with people who are have a global reach and are changing the world. So the thing I always want to remind you is that you are the caregiver. You always want to have some kind of composition book or notepad with you. But since today we're going to be talking about ICU and critical care units, intensive care and critical care units, we want to be sure that you have a composition book with you when you're there. If you don't have one and you get a chance to run to the gift shop, or somebody calls and asks you what you need, tell them that's what you need, because critical care and intensive care are high, fast-paced areas of a hospital, and a lot goes on, and sometimes things happen quickly, and so you want to be able to document what's going on, or write down things that you have questions about when you don't feel comfortable interrupting what's going on to ask a question. Let's see. All right. ICU, intensive care, critical care. Some of them are called the same, called different things, but they are the same kind of unit. Some hospitals have a medical intensive care unit. Some have a surgical intensive care unit. Some have a heart specialty unit. But some hospitals are not large enough to have all of that, so they just have one or the other. So the people who are in these areas are the sickest people in the hospital. The conditions can range from a stroke or heart attack to a surgical complication or respiratory, which is breathing, serious issues, or people who've been in traumatic car accidents, or fire victims, or in this day and age could be gunshot or trauma victims as well. We want to talk a little bit about who is there with them. So the nursing staff that's in the critical care unit are nurses who have been specially trained in critical care. So they know exactly how to work with people who are who have these issues. They have specialized training, and so they're not the nurses that you're going to run into in the rest of the hospital. They tend to have less patients than than the nurses on the regular wards, so they probably won't have more than 2 to 3 patients at most, whereas regular wards will have more patients to work with. The patients that are in critical care are on powerful medication. They may need specialized medical equipment. I'm sure you keep hearing now with COVID-19 about the need for ventilators. Ventilators are what help people breathe when they are having a serious issue with breathing on their own. So it's more than oxygen. It's a big machine. Um, that has cords and tubes coming off of it, and they are literally breathing for the patient. They are helping to force air in to make the patient's lungs rise and fall with oxygen. Um, and these patients in critical care or ICU also have to have their vital signs continuously monitored. So when you see someone when you're in critical care, or when you have a patient of yours or a person you're taking care of in critical care, you will notice that they have more equipment attached to them. Their vital signs are monitored more frequently, even if the nurse is out of the room. And generally, for these rooms, it's like a ring of rooms around the nursing station, and they're usually glassed in doors so that the nurses can see what's going on in the room, as well as watch the equipment. Um, the nursing staff is back and forth in the room much more often than they are in a regular hospital room. Um, so the pace here can be very fast, and it can be very intense. You can feel a little overwhelmed because things are changing quickly from time to time. So a patient may be doing well and suddenly start something to change, and the nurse will see that. The nurse will come in if the nurse feels the need to call um, doctors in quickly. That happens as well. You can still, though, feel comfortable that you can ask the nursing staff and the doctors questions. You may have to determine when is the best time to do that. Sometimes things will happen and you're like, what's going on? What's going on? And they don't really have time to stop right then and tell you what's going on, because your patient's in a critical state. So you want to bide your time, or determine when is the best time for you to ask a question. And sometimes during a quiet spell will be a good time for you to ask the nurse, when is a good time for me to ask questions if I have them. um, I will tell you, I have been in ICU as a patient in the last couple of years. My blood sugar had gotten too high, and I had to be admitted and was put on an insulin drip. And so most people don't know this. I think this is the first time I've said this publicly. Maybe 3 or 4 people know. Um, but they had to monitor the drip to bring to give me continuous insulin to bring my blood sugar down. So every 15 minutes they were coming in to check my insulin levels, and it's not a place to rest at all. So I was fortunate. I was able to go home the next morning, and it's pretty rare for people to be discharged from ICU and go home. Normally, there's what's called a step down process. Patient will go from ICU to a regular floor and then be discharged. Um, let's see. There often is, oftentimes when you're in ICU, you are in a teaching hospital. And so when the doctor comes in, there will be more than one doctor coming in at the same time. Um, think Grey's Anatomy. The doctor will be asking questions, and and don't be concerned that the doctor is teaching at the same time. However, in most cases, if you do not want your patient to be part of the teaching team or the teaching rounds, I think you can go to the nurse's station and make that request. You don't have to participate in that. Um, or at least you didn't used to have to participate. But understand also that these are not novice doctors. These are doctors who have graduated from medical school. And they have been trained. They're just getting specialty training at this point, doing their residencies uh, or in special further education on medicine. Um, do. Okay, because the person you're taking care of is in this unit. You don't have the same kind of visiting hours, so everybody is not necessarily allowed to visit. There may be only one person allowed in the room at a time, and generally there is a family waiting room or family visiting room down the hall from the critical care or intensive care unit. um, and sometimes even those waiting rooms are very small. For people who wait overnight, sometimes you may find um, people are sleep on the sofa or on a couch or in a chair there because they don't want to go home. They don't, or they're not close enough to home to go. Uh, so a lot of times, family members will stay overnight in the same in the family visiting room, so that they can be close by in case there's a change. Um, you are not allowed to eat in those rooms, so those are also so usually the family waiting room is equipped with. They may have vending machines close by. They may have coffee or tea or hot chocolate in or water in those areas. It It's usually a quieter family waiting room than the other areas are, and so and people, just tend to be mindful of one another in those kinds of areas. Um, so from critical care, intensive care, the unit is always going to have some patients who do not survive, who are just their situations are too critical and they pass away, and that can be a shock sometimes um, for people. Sometimes, excuse me, you know that that's coming and you just are kind of waiting. I have been in areas where we thought people were getting better and they took a sudden turn for the worse and did not survive. Um, it you just have to be, it's hard to be prepared, but it is necessary to be prepared that things are not always going to go the way that we expect them to. um, However, as I said earlier, a lot of times patients are they get better and they are able to be downgraded and moved from the CCU or ICU to a regular hospital room, and eventually discharged and sent home, or discharged and sent to a rehab facility, and then sent home. It is a process. So I will tell you that it is a good thing to know that you're getting good care, that your care is specialized when your family members are in intensive care. Uh, but you still want to keep your notebook. You still want to write down questions. I was with family at one point where someone was in ICU for several weeks, um, and eventually was downgraded and sent to a rehab facility. But it is uh, it is a serious area of the hospital to be in. Of course, being in the hospital period is serious, but these are the most serious patients that are in the hospital. Um, I had said I was going to talk about research today and places to do research. I'm going to belay that until Thursday, and I will Thursday post a document that has some of the places that I do medical research, um, places that I trust, because there's a ton of information out there, and it's in this day and age. As soon as the doctor tells us something, we run um, to the internet and look, and sometimes we come up with the worst things possible because we didn't look in places that could be trusted. So I'll be sharing some of that. Um, I did post, they should be coming up around 12:30 today, two articles that will talk a little bit more about critical care, what the critical care units are like, what you can expect. And one of the articles talks about the different types of people that you will meet, or that's possible that you will meet. It gives a little definition of the people who you'll find in critical care unit working. And also, shortly we're going to be out of the hospital, out of the emergency room, and I would like some help on what you would like us to talk about next. So there is a poll on taking care of us, and there are 3 questions on there, and please feel free to answer. Click on the answer, and if you have a suggestion, please post it underneath the poll in that comment section. And I look forward to seeing you on Thursday at noon, and we'll talk about research and how to do research, especially it won't be just medical, but it probably will be quite a bit of medical. So thank you so much for joining in with us today, and we will see you on Thursday at noon. Have a good week and stay safe.